Polycystic ovarian syndrome, or PCOS, is actually the commonest hormonal issue in women worldwide. It affects around 5% or 1 in 20 women. There are three main parts of what makes up polycystic ovarian syndrome. The first is the woman having irregular or absent ovulations, which means irregular or absent releasing of an egg, which shows up as irregular or absent periods. The second is having problems with her skin, so hirsutism, and that can be excess body hair, perhaps noticeable on the face or the back or the chest, or acne. And the third issue is ovaries that look polycystic. What that means is on ultrasound scan we see that the ovaries, rather than having maybe sort of 5 to 10 little resting follicles within, have more than that. They might have 15, 20, 25, 30 little follicles within the ovaries. Now if a woman has at least 2 out of 3 of those things, so either irregular or absent periods, hirsutism, so excess body hair or high levels of blood hormones, or ovaries that look polycystic on a scan, then that makes up the definition of polycystic ovarian syndrome, or PCOS. From a fertility perspective, the main issue really is the lack of ovulation. So that's really what we focus on from a fertility treatment perspective at Child Fertility. We'll be assessing your ovulation. If you're only ovulating 2 or 3 times per year, that's not enough to give you a good chance of natural success. So what we're trying to do is to optimize your ovulation. We'll be working with you in a very personalized manner to help you optimize lifestyle, to optimize your weight, for example. Some women with PCOS will have issues with their weight. They might be overweight or underweight. By optimizing weight, that can help improve the chance of natural conception. We also have tablets to get women ovulating. Above that, if that's not working, we have injections to get you ovulating. And if you're still not ovulating despite the injections, or if you are ovulating but you've not got pregnant despite the injections and the insemination treatment, we then move on to the top level of fertility treatment for PCOS, which is IVF. And IVF for women with PCOS is done the same as IVF for women with other causes of infertility. So for women with PCOS, we'll be focusing on getting the most appropriate investigations done in the quickest time. Those investigations will be hormone blood tests, just to make sure this is PCOS and that there isn't some other cause of why you're not ovulating. Those hormone tests will include things like anti-Müllerian hormone, so AMH, but also checks of your thyroid, your prolactin, and various other reproductive hormones. We'll be getting an ultrasound scan done to look at the ovaries to make sure the ovaries are polycystic. For women with PCOS who are trying to get pregnant, there's a very, very good chance of success. That can come naturally if perhaps weight is optimized, but sometimes treatment is needed with either tablets, injections, insemination treatment, or IVF. But overall, I think women with PCOS who want to get pregnant, even though they might need help, have an extremely good chance of success.